Thanks. It's really an honor to be among my colleague deans, to be hosted by one. And did you notice that every one of us started with a personal story? Because that's where we come from. So my personal story, as you can hear from my accent, I wasn't born here. And speaking about cultural adjustment, so I was asked where I'm from, and I thought, how could I share in a few seconds that I was the youngest and first female working in the Amazon rainforest, serving the descendants of slaves and indigenous populations? How can I tell them that that's where I really learned what the value of a community health worker was, and not in 20 years at CDC? How can I tell them that I too lost everything because I joined Tulane 3 weeks before Hurricane Katrina? But how can I tell them that there is no way to compare the assets that I had with the people who lost everything in the lower Ninth Ward? How can I tell them that because of Hurricane Katrina, I left behind a 10-year-old and a 12-year-old with a husband, while I felt committed to work with the people in the lower Ninth Ward? And so that's the story that each one of us have. And what I wanted to share, I learned when I joined Pitt. People ask me, well, why did you leave New Orleans to join Pitt? The climate is a little different there. I said, because all the assets were there, particularly in one of my four strategic imperatives, and that's diversity, equity, and inclusion, but they're not necessarily connected and leveraged. I've also learned that we are the city of the largest number of bridges, 456 or something like that, so come visit us. So this afternoon, what I'd like to do is discuss a framework for advancing anti-racism strategies on campus. And I had my great colleague here already earlier this morning to highlight some needs to examine and replace some policies and to discuss the importance of stakeholder engagement. So one of my 4 priorities, as I mentioned before, is diversity, equity, and inclusion, but it's also that of the entire university, where we created a culture change initiative. I mentioned culture, and I started my story with culture because that's how we learn, by knowing each other's, by taking time to know each other's culture and agreeing and committing to changing it, in this case, the DEI piece. I'll come back to what we're doing in the school. One of the things I've learned, and I don't know whether you know it, and I might be late to the table to learn that, is that the term pipeline is actually offensive to our indigenous brothers and sisters. It is, pathways is a preferred term, and so you'll see me doing pathways, using pathways instead of pipelines. So the plan for Pitt has a number of values that you could see, but I want to emphasize the 3 goals. So as all universities, there were 6 goals and an equal number of objectives, and you know, by the time you're done, you're 15 pages deep, and very difficult to measure what actually needs to get done. And so there are now 3 goals: our people, who we are at the university, our programs, what it is we do, but I'm particularly keen on what our purpose is. And our purpose is where communities are the central piece of what we do. We joined with 57 other universities the Inclusive and Diverse STEM Faculty Institutional Change Network, the iChange Network. And we haven't talked about, and I'm looking forward to talk about data, how we collect data, how we analyze data, but particularly how we share data. How we share data not only among us, but how we share data with our communities. And so that self-assessment process is currently ongoing. As part of, as you have already heard, the George Floyd incident, our community, our academic community, stood up and said, we need to start that learning at the earliest possible time. And yes, we could have made it a required course, and it is, but what we're doing is we're automatically enrolling all first-year students. So they don't have a choice. It's on their curriculum. And all of us teach in it, so all faculty across all the schools. Within our school, we have the strategic plan, as I mentioned, one of our 4 goals, we have a research center that not only focuses on health equity, but we also have a research center that focuses on LGBT health, and I'm very proud of that research center. Within the Center for Health Equity, we have a community advisory board who voluntarily, faculty members can present their aims page, so not only to the project officer at NIH, but present their aims page to communities to get a reality check. Will this research make a difference? I want to come back to this, this pathway thing. This is where I'm putting my money and my time, is to create a new kind of community in our home at Pitt Public Health. Here you see a set of high school students, and 2 of those high school students that I was privileged to be a mentor for, actually is a high school right next to us. But they never put foot in our school. And so now we've created that pathway, and we surrounded each of these students with mentors that were faculty, PhD students, and master students. And they visited with the mayor, and we're so thankful for having a mayor, Mayor Gainey, who got public health. And his focus is on gun violence. And so he hosted all of the students. So I was so pleased that happened. Climate and health, and yes, we'll deal with COVID, and we'll deal with all the other infectious diseases, but climate and health is the singular public health issue that will be for us for a long time, because again, we're unwilling to make changes. And so these are 2 of my students as part of the Public Health Science Academy, the high schoolers that spent a month with us. And they're 15 and 16, so you can't send them really too far. And so this is around our building on De Soto Street, and they were measuring both surface temperature as well as ambient temperature. And here's what they found, and they were quite surprised. If you look on that cell phone, I'm not sure how good you can see it, the ambient temperature that day was 74 degrees. The temperature, however, in the wood chips was 133 degrees. So it doesn't take long to explain that we need trees, but not wood chips. It took 15 and 16-year-olds to get that. We're publishing their research, and I'm so proud of them. We're also very proud, and personally I'm very proud, because I put everything aside that deans do and applied humbly as a principal investigator to this program from the Centers for Disease Control and Prevention, where they bring together, and I'm hoping BU students will join us as well for 8 weeks, undergraduates, so juniors and seniors, and graduates particularly from community colleges, to be embedded with us for 8 weeks. And we will focus on the things that matter most and the things that the city should never be proud of. Areas: maternal and child health, environmental justice, and climate and health. And so they'll be with us 50 students nationwide, and we'll actually measure what needs to get done. I want to come back to, before we go into this more comprehensive network and talk about what the policies are and how much we're doing. We have a long way to go, as many other universities do. But I want to come back to the issue of cluster hires. Yes, we've invested in 63 cluster hires, both African American and Latinx, and the university is guaranteeing 75% of their salary for the first 4 years. I am going above and beyond that. I am guaranteeing 100% of their salaries for the first 7 years until they go through tenure. So that's a policy that each one of us as deans can undertake beyond even what the university is guaranteeing. And so there are, in this anti-racism framework that's coming from the National Association of Diversity Officers in Higher Education, 10 principles and policies, and it's probably a little too small for you to read, but the idea is that we make changes and we make progress in each of those policies. But as we do, we need to create a space where people feel safe to be comfortable and learn. Because not every one of us, although you heard our stories, not every one of us has that same level of comfort. If you remember the educational kind of trajectory from awareness to consciously incompetent, consciously competent, and mastery, we are in the area of awareness and maybe consciously incompetent. We know that we're consciously incompetent. But we're not at competence, and nor are we obviously at mastery. So what is it that we're looking for, and what are some of the policies that we collectively as a family and academia can work on? I'll share with you some of what we're doing. Certainly access, and everybody has the legal issues and affirmative action and EEO. Freedom of speech is a big one for us, and it is true for many of our institutions. We're renaming buildings, and a number of us have done that. Our faculty have voted over the summer to join the union. And so our faculty are now unionized. And that creates a new way of behaving and working as a family. I mentioned the retention issue that we are putting in place, not only the university, but our school specifically. There is a lot that's going on around disciplinary actions, but I'm very hopeful that we are making changes in tenure and promotion. Every course in our school has a required element of diversity, equity, and inclusion. Diversity, equity, and inclusion is a required element of performance evaluation of our faculty and our staff. I've tried to work on salary equity, but then there was bargaining going on, and so we'll pick that back up again. I want to make sure that we learn from each other as we all embark on changing policy. And so I shared with you where we are, and as you could see, we didn't check any boxes. We didn't check all the boxes. At least we're making progress in some of the boxes. But what I'm particularly proud of our university committing for 15 years an investment in community engagement centers. These are 3 centers in our communities, in our most at-risk communities in Homewood, Hazelwood, and the Hill District, where we're embedding our faculty and our students. So the high school students work there, the CUP students will be there, but also our faculty will be there. And so we're going to the community, not asking the community to come to us. So I'm hoping that this gives you some examples of the kind of policy that we're doing. It leaves me to show you one of the bridges, don't get stuck on them, and to acknowledge my contributor, Dr. Covert, and looking forward to the group discussion.